Right now, people that present to the emergency room, for example, they come in, they maybe feel symptoms of a racing heart or some fainting type things where they present to the emergency room because they feel something serious is going on. And with some simple assessments in the emergency room and a device like the Body Guardian, physicians can basically put the Body Guardian on a patient in the emergency room, have a monitoring center evaluate that rhythm that they see right when they're in the emergency room, do some simple evaluations to figure out are they at risk for a more serious issue. And then if it looks like they're actually in a pretty good state of a non-lethal rhythm, be able to send them home with a device like this, monitor them remotely, from the remote monitoring center to make sure that they have that comfort that the patient is receiving the care they need. Today, the approach is that they just admit them by default, and it's a lot more expensive. And basically, a device like this can help save a lot of cost in that.
How long would that take to make that kind of assessment using the Body Guardian?
I think the amount of time that somebody's actually there in the emergency room, probably within an hour or two, I would guess that they would have a pretty good assessment of whether or not the rhythm is something serious that they need to be admitted for, or if it's something that they can monitor remotely. Again, the emergency room physicians are typically not cardiologists, so their default assumption is to get them into the hospital system and get to a cardiologist. If they can be assured that they're being monitored by cardiologists or cardiac trained technicians, they can have that comfort that they're not sacrificing care and that the patient's still safe.